It's probably 3 or 4 years since I heard about it, and it was actually not long after that that I got involved in it because I was kind of intrigued by the possibilities. I'm a child and adolescent and adult psychiatrist, so I've got certifications in adult psychiatry and child and adolescent psychiatry and addiction psychiatry. So that's the sort of the core of my background, and what I was doing before the neurofeedback training is the same thing I'm doing now. I have a private practice. I mean, we're sitting in my office right now, and I see people here 6 days a week, and I am still doing exactly the same thing. I've added neurofeedback as an additional treatment modality. Neurofeedback has simply become one of the possibilities in terms of treatment, interventions that is available now, and so I'm always using it in an integrated way. Most of the time, I'm using it as part of I mean, typically in psychiatry, you have pharmacology or medication treatment, and you have talk therapies, various forms of psychotherapy. So I'm still doing both of those things. Neurofeedback simply has become an additional thing that I integrate, with those modalities. So for most people that I'm doing neurofeedback with, I'm not, it's not only a standalone. It's something that I've integrated with the other treatment things I'm doing. Prior to doing psychiatry, I was in family medicine, and if I look back 20, 25 years, there was a time when if someone didn't get a pill from me, when you go to the doctor, you get pills, and if you didn't give people pills, they got mad at you or got disappointed at the very least if they were a little more polite. That's changed radically over the last 20 years. So I think really in many ways, none of my patients said to me, look, why don't you do neurofeedback? But I think there was always there's a growing cultural shift, I think, in terms of people wanting to do things in a more, I don't even know what the word is, perhaps more natural way would be a word that sort of describes it. And I think that's one of the things that neurofeedback possibly offers is a more favorable side effect profile, a more health-oriented intervention where, again, you're trying to optimize function, and so it's it's a way of intervening with people that I think is in tune with what seems to me an evolution in people's thought processes and their sensibilities about what they want to do with their health care. I can use it as an adjunct treatment in almost all the cases I treat. Anytime there is a symptom that someone has, you can develop a neurofeedback intervention. Whether you choose to do it or not, it becomes the thing. And so I'm constantly in this dialogue with people and this thought process, this dialogue with myself about, would it be the most efficient use of time and resources? Is it the most attuned to this particular person's needs and their sensibilities? And so, it can be used for almost anything I treat. Whether I do it or not has a lot more to do with the person I'm treating, whether they want to do it, whether it fits who they are, and a lot of times whether they're willing to make the time commitment to it, because it does take a lot of time, and not everybody's willing to, use that amount of time. Well, yeah, I do have a background in neuroscience, having studied medicine and psychiatry. So, but what I found actually, interestingly enough, as I did the Othmer's training, I found that it's perhaps less the absolute knowledge base that was presented, but more the paradigm out of which they work that I found particularly useful. I mean, they really typically in psychiatry, you're looking at isolated syndromes, and so that it's very typical for a given individual to have 3 or 4 different syndromes or 3 or 4 different diagnoses that you're making. With the neurofeedback, the Othmer's approach, what I found is a much more integrated way of looking at things. So they're looking at basic brain function, symptoms as a result of lack of coordination of brain function, as dysregulation syndromes, as over-arousal syndromes, as under-arousal symptoms. And actually it's a very satisfying paradigm. I think it explains a lot. It's a fascination to me. How people work and what makes them do what they do since I was a kid has been my fascination. So it's just what I'm interested in. It's what I care about. So it's easy for me to do. I really look forward to the developments in the field. I mean, there's a lot of exciting things that are going on. There's a lot of very lively discussion in terms of different treatment approaches, and I really hope that that discussion continues to advance the field. I see the field slowly moving more and more into the mainstream. Even over the last 3 or 4 years that I've been doing it, I think there's just more, it's just moving in that direction, and I see that continuing, and as the field develops, I can see that happening more and more, because again, I think it's aligned with a sensibility that's emerging in the culture, and so it not only professionals advocating for their own treatment approaches, but rather there's a desire on the part of the community and on the part of the culture to have forms of treatment that are like neurofeedback. And so, I think it's exciting.